oversight for companies selling antibody tests. That's the aim of a new policy from the Food and Drug Administration after unproven and fraudulent tests have flooded the market. Mandy Gaither takes a closer look at what's being done to stop it.
The FDA will now require antibody test makers to submit emergency authorization requests along with proof the tests work within 10 days. The agency is also setting specific performance recommendations for all test developers, saying they will work with the National Cancer Institute to independently validate antibody tests on the market. Antibody tests are used to check for prior COVID-19 infection and can provide a better sense of how much of the population has already been infected and might have some immunity to the virus. It's still not clear whether the presence of antibodies means someone is immune or how long that immunity might last. In mid-March, the FDA loosened approval standards in an effort to get antibody tests on the market, but it quickly became clear that many of those tests were unreliable. A number of tests had high rates of false positives, which could give people a false security by leading them to believe they've already been infected and have immunity from the virus. The FDA hopes by validating antibody tests, the agency will have better data to decide whether to authorize the test, work with the test developer to sort out fixes, or block the test from marketing in the U.S. For today's Health Minute, I'm Mandy Gaither.
So far, at least 10 antibody tests have been given emergency use authorizations. More than 200 of these tests are currently being reviewed. The race to find effective treatments for COVID-19 has led researchers to llamas, specifically a 4-year-old llama from Belgium named Winter. Winter's antibodies have shown promise in preventing the coronavirus from infecting cells. Researchers in Belgium and the U.S. published the findings this week. The hope is that the antibodies can be injected into an uninfected person, protecting them for a month or two at a time. More children in New York are being hospitalized with a mystery illness possibly linked to COVID-19. According to the state health department, at least 64 cases were reported as of Tuesday. None of them have been fatal. Most of the patients had tested positive for COVID-19 or coronavirus antibodies. Symptoms are similar to those of Kawasaki disease and toxic shock syndrome and include fever, red eyes, rash, upset stomach, and in some cases, cardiac arrest.